YouTube live question answer sessions. So we are live both on Instagram and YouTube. I hope and wish everybody a happy and a prosperous new year. So if you're ready with your question, we'll start. Otherwise, I'll discuss a case and then we'll start. So welcome Dr. Gaurav Sharma. Now, of late, there is a lot of the winter is there, and there are a lot of conditions in relation to winters. And in homeopathy, we have lots of remedies, where we find that most of the complaints are aggravated or come during winter. This again is a very, very important thing, where you have to understand that when to use which remedy, and when not to use a remedy. For example, in winters, there are so many remedies, where winter is aggravation winter, and we normally have remedies like arsenic or hepar and you prescribe those remedies. But there are some remedies which are very, very important that you should remember. And in those remedies, it is very, very important that winter aggravates or cold aggravates the complaints. Welcome, Dr. Shusti, Dr. Amisha, Dr. Sharon, Dr. Shrutik, Dr. Anja, Dr. Nagvek, Amit. So whenever the patient comes and tells you in winter his complaint aggravates. Now this again has to be a defining symptom of the whole constitution. The whole constitution should have that aggravation in winter. Of course, one of the most important remedies, arsenic album or metallicum are there. But there are some remedies, there are some remedies also where you have to see that in that remedy also winter aggravates. You'll be surprised that if this symptom is there in that patient, that winter aggravates the complaints, do think about Naxomica, do think about Kali carb, and do think about floric acid also, where winter aggravates. That's again a very, very important symptom in relation to floric acid also. Of course, there are remedies like rustox is there, soranum is there, petroleum is there, arsenic is there, or metallicum is there, but Naxomica is there, floric acid is there, and Kali carb is also there. So normally we don't think about Naxomica, but it's a very, very important remedy when the patient has a very precise symptom, winter aggravates, in the whole case taking that is the defining symptom of that case or the patient. Welcome, Dr. Babal Suresh. Sir, please discuss case of infertility, what we should see in the couple. Yeah, it's a very, very, very long and a very, very, very vague question, but still I'll try to answer that question. KF, welcome. So whenever you're treating a case of infertility, whenever I'll give an example. Whenever the soil is infertile, we first try to make that soil fertile by putting in lots of fertilizers, by watering it, by lots of things. Yeah, welcome, Dr. Aha. In the same way, fertility in case of female, it is specific there. That means that this is Sora. The need has not been fulfilled. The need could be need of love, the need of attachment, the need of appreciation, the need of acceptance. These are very, very important important things that you should look in case of infertility, especially in female. For example, a lady comes and tells us that, yeah, I had an affair with somebody and then it did not materialize. That boy had some affair there. In past also, I was not so loved child. I was elder in the family. There were 6 siblings, and I had to always adjust in life. So the need of attachment, the need of love was not there. And this case comes to you, case of infertility. Husband also not good, not responding properly. So in the whole sequence, she has been lacking that fertility, lacking that need of love, and that is Sora. So whenever that is there, you think of these remedies. Then you can go into rubrics where you can say elements from maybe rejection, elements from deception, elements from disappointment, or being alone or not loved being. There are a lot of other conditions, especially in ladies. So as you have infertile soil, you increase the fertility by putting a lot of fertilizers. The fertilizer for a female is basically the need of love, the Sora, the attachment, the appreciation, which was lacking in that case. And lots of cases I've seen having these type of complaints where she has these type of indications, and it has given me very good results. So maybe not in all cases, but do look, Dr. Sharon, in some cases where this is missing in the child, in the lady, and that has given rise to a stage of infertility. Okay, of course, if there are secondary causes of infertility, maybe the tube is blocked, it's a different thing, or there's no sperm count, azoosperm, it's a different thing. A secondary the anti-mullal hormone is not, it's a second thing. But basically, this in homeopathy I've seen very, very important. The love, the attachment, the appreciation, the need, the sora is not there, the fertility is not there, and that's why we'll end up in infertility. So do think about these points whenever you're taking a case of infertility. In short, I can explain you this way. Yeah, Dr. Vishal, good afternoon. So this is basic. So I was just talking about winter, and I told you some of the remedies. Of course, if you open the Mater Medica, then there are lots and lots of remedies. Okay. Patient come. Good afternoon, Dr. Vishaka. So sensitivity of teeth for cold air drinks seen in these days. Yeah, see, whenever you have cases, where it is sensitive to cold air, sensitive teeth and all, see, these are very, very common symptom in case of teeth, that the patient has pain, the patient has looseness, especially when the cold air is blowing, if he goes in winter and all. I don't know whether you'll get 100% results by using basically prescribing in these cases, but of course there are remedies. If there are remedies like you have synapse nigra, you have staphysagrina, you have chamomilla, you have natrum carb, you have sulfur, you have these type of remedies. But see, whenever there is sensitivity is there, as I always tell you, see whether the whole constitution is sensitive. If the whole constitution is sensitive, then you can enter the case from sensitivity. If there is no pathology in that teeth, if there is caries, if there is infection, if there is abscess, then you can take the local symptom of maybe cold or aggravation. But take the case as a whole and then describe the case in relation to sensitiveness. Otherwise, there are remedies which I have told you which can give you good results. Rare remedies which I have used in my practice is Ichnisia angustifolia, calendula, and of course, plantago, everybody knows, and Azadirachta indica, where there is sensitivity to the teeth, especially when there is some pathology, slight caries, or maybe enamel has been taken lost, or because of a lot of acidity, there is the teeth have become very hollow. In these cases, this remedies works very nicely. Patient comments the vomiting case sent on WhatsApp. Please comment. Yeah, doctor, I think it was Saturday, so could not see the WhatsApp today. There was a lot of rush in the OPD. So maybe I'll tell you in the next YouTube, or maybe on WhatsApp I'll reply to you. How to increase HB in CKD? No, see, basically erythropoietin, which is present in the kidney, stimulates the bone marrow to produce hemoglobin. Kidney failure, the basic reason is that only that in kidney failure, because the kidney is failed, there is no production of erythropoietin, and that's why HB is less. So if there is some medicine to increase the HB, that will increase the kidney function, and that will automatically cure or treat the CKD disease. So there is no specificity I have seen in any case, but in allopathy they give that injection of erythropoietin which increases the hemoglobin. But I have seen in cases where you use more of erythropoietin, that's also a protein, that may also harm the kidney. In homeopathy, you can think few remedies which I used to give before, that is ferrum-phos, one. Second is lecithin, and the third is 5-phos. In low potency, 6x potency, repetition, which will basically help the vitality of the patient to be stable, so that it will be able to fight the disease, and other medicine can act very well, and the patient has the symptoms of weakness are less. So sciatica pain, right sided aggravation when excesses, brinjal, pakoras eating, movement hindered in bed, tired, McFirst Lyco failed, please put some Litrastox also given, failed. See, whenever you are treating a case of sciatica, and it's a fantastic modality, eating pakoras and eating what you call brinjals aggravates the complaint. I have never seen these type of cases in my practice where these type of complaints are there. Now, of course, if you are basically prescribing only for that part, that right-sided sciatica is there, especially on the right side, then you must think of remedies which are more related to right side. For example, if my mathematics goes, you have already given lycopodium, which is definitely a right side remedy. Don't forget 3 or 4 remedies which are very, very useful, Dr. Amit. You'll be surprised in right-sided sciatica, lachesis works very well. Think about lachesis. Fantastic remedy with the symptoms which you have told would definitely work. Second remedy, which is again very useful, which is again a right side remedy, and that remedy is colocynth. A fantastic remedy for sciatica. Do think about that remedy. Third remedy, diascoria, and fourth remedy, phytolacca. I think your case will fit in these 4 remedies, either lachesis, diascoria, colocynth, and phytolacca. Welcome, doctor. I am one. I hope I'm answered you properly, taking your name properly. I just want to tell you that I had a couple case lately with dry, stuffed up nose and breathing through mouth, like you told us lycopodium's remedy and gave quick relief. Wow, thank you so much. So we have a very interesting results by Dr. Smith, Anja, and she is told that whenever what I told about lycopodium, she has applied that in the practice and she has got good results. So thank you for sharing the results, and thank you for at least giving me some adrenaline that whatever I'm sharing with you in my YouTube live since years now is helping you to develop your practice. I know that half an hour is not a sufficient time, but whatever I can give you from my clinical knowledge, I try to give you. But I am very happy. Keep growing in your practice, and please keep sharing your cases so that everybody gets to learn from everybody. Because homeopathy is such a science that nobody is a master and nobody can ever be a master. It's always a growing process. So thank you, Dr. Anja, for sharing your case. Thank you, Dr. Amit. I hope, Dr. Amit, you get this result. Sciatica is such a condition. It's a very painful condition. Even modern science have very less only painkillers to treat this. And when there is a lot of compression and the patient cannot walk, cannot sit, it's a very painful condition. So I hope you get this results. Try these 3-4 remedies and basically will be able to help the case. Please give light of expression, acute disease in typhoid form from Uppal Pal. Light on expression. Nice, I did not understand your question, Dr. Paul. Can you ask in some different way? Yes, so acute disease in typhoid form. I don't know what you want to ask. Do you want to ask some acute disease, how to treat acute exacerbation of a disease or typhoid-like symptoms in a disease? So be specific, so I'll be able to answer the question properly. As you go further, I was just telling you something about winter remedies and which type. What do you want? You want acute disease expression? You want typhoid-like expression in acute disease? Which be very specific what I want to ask so that I'll be able to answer a question. In typhoid, basically, then I'll basically be speaking for typhoid and the acute symptom which arise because of typhoid. Those things otherwise. So immediately, just maybe try to explain your question more so that I'll be able to answer it properly. Yes, so I was just telling you something about the winter remedies, and most of you must have seen a lot of winter remedies, but these remedies, which I have told you, these 4-5 remedies, such a interesting remedy it makes. And if your constitution is exactly aggravation winter, aggravation taking cold, then these 4-5 remedies will basically work very well. Okay. Yeah, Dr. Pal, I'm waiting. You please explain the question more so that I'm able to explain the answer properly. Okay. If you want only expression of acute disease, that means how the acute disease be manifested and what to see in those cases. Of course, in acute disease, one thing is very important. The patient narrates the symptom quite particularly, and the PQRS symptoms are seen very well because the patient remembers everything in acute disease. Like, for instance, the patient comes and tells you that I have a lot of sneezing, and whenever I sneeze, I feel as if it will take my life. So sneezing is so violent. Whenever I sneeze, I have something as if something is crawling inside my nose. Or whenever I sneeze, I basically make sure that I am not present in the crowd because there's a lot of mucus that comes out from the sneezing. So in this way, there are a lot of acute expressions which the patient remembers it very well. It is very important just to know that how is the acute expression of the symptom taken care of by the doctor, how you interpret symptom. In some, suppose a patient comes to you, I cough, and then I sneeze and the coughing is better. This is again a very, very important symptom. So these are symptoms in acute expression. The patient has to be questioned very properly because he just remembers everything what you want to ask. Just look at the mathematic and you will get the remedy or the repertory also. To in these days it is so. Yeah, and rust talk securities and typhoid fever. I have never gone through these type, but see, rust talks basically, if you open rust talks and see, rust talks has most of the symptom in relation to typhoid disease. That's why it is said that if you open rust talks and if you open just see the fever of rust talks, it has most of the symptom in relation to typhoid, like uh, dry tongue, brown tongue, sores. The bowels are loose. There is a lot of restlessness. There is urticaria during heat, and aerodynamic fever, restlessness, trembling, pain in the abdomen. These all symptoms, acute symptoms, and it mimics a typhoid like disease. That's what is written in that way. Welcome, Dr. Sinha. When about a baby with vomiting can eat snacks like crisps and biscuits, but vomits most food, especially warm, has hiccup and then vomits with stingy mucus. He's 2 years, taking old, started one. Now, whenever you say that, whenever the patient says that, but now exactly if you have given a very, very interesting modality, that by warm the patient vomits. Now, if you are basically treating these type of complaints, and if the modality is very, 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 very important, in this case, Dr. Rahat, two things are very, very important. Either you go with the modality that warm aggravates, or you take a modality that discharge is stringy, stringy type discharge. It can be held in long strings like calibacrom. And calibacrom is also a very, very important remedy for vomiting. But you have specifically said that the patient can eat everything, crispy, anything, but except warm water. Three drugs that comes to my mind which are very, very peculiar in this symptom. The first is phosphorus, the second is bryonia, and the third is pulsatilla. So very important, but just by the patient has warm drinks and the patient starts vomiting. So this is very important. And now there is one more symptom, that whenever the patient eats warm food, that is also important. I have told you warm drinks because you have told warm drinks. But if the patient comes and tells you that the patient eats warm food and then the patient vomits, remember again two or three remedies, very, very important, Dr. Ha. The first is again phosphorus. Phosphorus covers both warm food aggravates and liquid warm drinks aggravate. But warm food causes vomiting. Two remedies very, very important, out of which one remedy I have used much in my practice, and that is Lobelia inflata. The second is Vespa, and third is phosphorus. No warm foods. Okay, warm drinks. So you can pick this remedy: phosphorus, bryonia, pulsatilla. Very, very important in this case, and you can either give on that symptom or the discharge is stringy, that symptom, both. But I think warm drinks would be better because the patient is able to eat snacks. That's a very important symptom. So can you tell a rubric for conditions, sudden onset, hot feeling, and again for some time chilliness alternating before and as big? Yes, so you can take alternate chilliness alternating with heat with chilliness. There are rubrics like this, Dr. Indranil Rastoxia. Dr. Priya says, good afternoon, doctor. Doctor, can you suggest remedies for gallstones? Gallstones, we have done a lot many times in YouTube. And if you have seen my YouTube live before, also we have done lots many in gallstones. Of whatever I can remember, I have told a lot of remedies, but 4 or 5 remedies that everybody should think about, that is Filtauri, Cardusmar, Berberis vulgaris, uh, Cholesterinum. These are, and belladonna for pain, and colocynth. So these are 4 or 5 remedies which are very, very important, and you should always read these remedies before going into other remedies. Of course, prescribing for constitution is the basic thing, but these are acute remedies which would help in this case. Dr. Tunish, welcome. She's 4 months. Yeah. So, Dr. How you can try this remedies. Worm aggravates. So this is worm aggravates. In these 3 remedies. So if the patient is not sure, if it is warm food also and warm warm drinks also, both are there. So if you repetize these rubrics, phosphorus is the only drug which will come. For warm drinks, Bryony and Pulsatilla would come, and for warm food, Lobelia inflata and Vespa would come. Of course, if you want to prescribe Lobelia, then you must see that after vomiting, what happens to the patient. If you see Lobelia inflata, it's Indian tobacco. It's a remedy where after there's so much vomiting, there's so much purging, the patient basically there is extreme nausea, and there is and then the patient becomes cold and cold to touch. There's so much vomiting like tobacco with profuse salivation and marked prostration. That's Lobelia inflata. So these are the type of remedy that you should think about. Yeah, you can always think about those facts, but in this case, I would first basically like to treat that acute condition with some remedy and see the constitution. In most of the cases, you will find that phosphorus works very well in these type of cases, and second is pulsatilla. But if the patient says the baby becomes very cold after being totally out, totally prostrated, becomes very cold and can't do anything, very marked prostration is there with profuse sweat and nausea, but the appetite is good, the patient eats very well, then you can think about the Indian tobacco, that is Lobelia inflata. He gets tired but still hungry. Yeah, good evening, Dr. Singh, Dr. Pushpinder Singh. You can give one of the three remedies, Dr. Ra, and I think it should work for you. So immediately let's do this again, the winter remedies, which I have a lot of questions for that. One remedy that you should remember, I always tell you that you should remember that remedy, winter aggravates, and the patient is better by sun, and the patient is better by heat. And the patient comes and tells you that he likes so much warm bathing. Unless it is very hot, he does not bath. He likes to bath in hot tubs. He wants everything so hot, and winter aggravates. Can anybody give me the remedy? Anybody? Winter remedies, I have told 4-5 remedies, I have told Kalikarp, I have told Foric acid, I have told Naxomic, I have told these remedies. But one Rustox is there. But one patient says that he likes such warm bathing, such warm, extremely hot, especially in hot bath also, such hot things. That which remedy is written basically in a remedic, hot baths ameliorate, hot, boiling hot baths. So we have lot of remedies which basically are chili. See, Rustox is chili, arsenic is chili. These are the remedies. Petroleum is there, of course, but I want that remedy. The patient goes out in the sun and wants to sit, in spite of skin becoming black and burned, but he likes everything so hot. I have few cases. I have discussed that remedy also. I had discussed that case of renal failure. Yeah, Dr. Babal, that was strontium carb. The remedy is strontium. Remember this remedy, my dear friends. Remember this remedy. This remedy will, otherwise what will happen, you will always forget strontium carb and remember all the chili remedies like arsenic, like you told, arsenic, Kalikarp is there, Hepasulf is there, arsenic is there, petroleum is there, phosphorus is there, Rustox is there, lots of remedies. Don't forget strontium carb. Welcome, Dr. Umesh. Strontium carb have given me so many good results in cases like this where the patient desires everything so hot, the sun is so hot, he wants to sit in the sun in spite of the skin becoming black and all burnt up, that's strontium carb. So this is, I'm just sharing winter remedies because in Nagpur the winter is of 3-4 days, the winter is very, very severe. The temperature is 10 to 12 degrees, and of course in all of parts of India it is very chilling. So we require these type of remedies, and okay. We have a quick knee osteophytes can be cured. No, see what happens if the osteophytes are there and they've already chipped off from the joint, and it is basically hindering the movement of the joint, and the patient says that my joints get locked and I can't move, I have to do something and the joints work. So basically in those cases I have tried to prescribe, the patient is better. In some cases the chip, if it is not left that joint space far off, it sometimes sticks to that, but still the pain is there. In these cases I have used some remedies which I can share with you. That is, I have used Phytoleka, which have got good results. I've used remedies, calcarea carp. I've used remedies lacasis, which has given me good results. But in some cases which I have failed, arthroscopy was performed and the patient is much better. Yeah, good afternoon, Dr. Smita, so Dr. Sajdev. Okay, so in this is basically what I have in my cases of osteophytes. Next, as you go further, let us not forget these some rare remedies which can be used in case of winters. I have told you some common remedies. Do remember one remedy which has again given me very good result, that is carbon sulf. Carbon sulf, calcarea silicate also, in cases where winter aggravates or cold aggravates, has given me good results. So do think about carbon sulf also in some cases. And if you have read carbon sulf, carbon sulf is such a remedy where the patient, whatever I get of carbon sulf is, there's a lot of hallucination of sight and hearing. The patient just has hallucination of what is hearing, and with changeable mood. That's carbon sulf with dementia alternating with excitement. So these 3-4 symptoms I have found very, very useful in case of carbon sulf. First is hallucination of sight and hearing, changeability of mood, and dementia alternating with excitement. Of course, then there are other symptoms of carbon sulf in relation to extremities, skin and all, but these symptoms of mind are very, very important. 786 joined, welcome. It's already 27 minutes, so you can keep asking questions very fast so that we can finish this session on a good note. With good, I hope you understood something about strontium carb. Strontium carb is a fantastic. Go home and read strontium carb. And I hope, Dr. Raha, you prescribe one of the remedies, and when you do get results, do share the case. The result of your case. Urine passes unconscious, me given CPR, calcarea carb, no result, male, child 6 years, continuous urine pass in night. See, whenever you have some cases where the urine passes unconsciously, or what you can say, don't always go with, causticum or these type of remedy. Of course, those are there, I'm not denying it. But there are some remedies, which are such important, which are such important. For example, we have a remedy, where the patient says that he passes. This is a question on Instagram. So when a patient comes and tell you that he passes urine involuntary day and night, day in and day out, the urine keeps on, and he used to use the pads for that. One of the very important remedies, which I have seen in my practice is, first is verbascum. Second is argentum nitricum. Day and night, it is such a very, very important remedy. Of course, I'll tell you some other remedies also, but just remember these two remedies, and the third one is Naxomica. Then you have a lot of remedies. You have arnica, you have clematis, you have cantharis, you have pulsatilla, you have staphysagraria, you have sulfur, and so on and so forth. But verbascum, argentum nitricum, Naxomica I have seen, the patient says he passes urine involuntary day in and day out. That's these remedies. And to add to these remedies, arnica, causticum you have told, pulsatilla, cantharis, staphysagraria, sulfur, and tabacum. This is what I remember now in my whatever I know about Mater Medica. Remedies for incontinence in female, especially middle age. Okay, there was whatever I told you. I think it would always suffice for this also. See, I always tell you that always try to define the symptoms more. That urine complaints are there day and night. See, there are a lot of other things in where you have to see. So this remedy should basically cover both the things. Urine inconsistency or urine. Then you have to see who has asked the question. Okay, Doctor. Well, okay. So Dr. Indranil is there. So Dr. Indranil, I would like to just tell you that if the patient comes and tells you that urine incontinence, especially in female, then you have to see when. In the night, especially we have incontinence in the bed in the night or in the morning, or when in the first sleep, in the second part of sleep. This is very important. I had a case where there was incontinence of urine after catheterization. Can you give me the remedy? Anybody? Incontinence of urine after catheterization. Anybody can get the remedy? Staphysagarria. No. Staphysagarria basically in newly married couples, that remedy is McFoss. Yes, Dr. Paul, very nice. After catheterization, the remedy is McFoss. And especially when you have females, especially incontinence at the night, whatever remedy I can remember, I just tell you. No, incontinence after catheterization, I have only read McFoss. Thalassemia I have not seen. Thalassemia basically is because of fibroid. Fibroid grows in size so much that it presses the rectum, the bladder, and then you have incontinence. So we have remedies where, especially in night, no, climatism does not have it. I'll just finish that answer of Dr. Indranil. So, incontinence of urine, there are a lot of remedies, especially in the night. Think about Cilicia, creosote, nitric acid, rustox, causticum, and equisetum. In the first sleep, now we'll divide the night into the first sleep and after that. So, in the first sleep, if you have incontinence, think about causticum, think about creosote, think about phosphoric acid, think about sepia. And then you can think of some other remedies, because this is the bad part, the first part of it. Then normally I had a case, the patient was very weak, and that's why he was suffering from incontinence, the child, especially in bed. And I gave, which remedy is there? When you have incontinence of urine in weakly children, the child is very weak, which remedy comes to your mind? Anybody? Like for catheterization, think about McFoss. For incontinence, especially in weakly children, which remedy comes to your mind? Anybody? Sina. No. That's why I added children's, not Sina. We have told in weakly children's. Remember, the remedy is China. Very interesting remedy, fantastic results I have got. Not Calcarafos, China. This is the beauty of Mater Medica. This is the beauty of Mater Medica. If your symptom selection is right, automatically you can get the result. Sometimes, the patient comes and tells you, just by blowing the nose, he has incontinence, involuntary urination. Which remedy comes to your mind? Anybody? Yes, Dr. Umesh. Equisetum, no. The remedy is China. I've just told you. Sometimes the patient comes and tells you that blowing the nose causes incontinence of urine. Then you must think about natriuretic. Yes, very nice, Dr. Indranil. See, you can keep asking me questions in between also, because when I start Mater Medica, I just go on and speaking every symptom, and then the time goes and you can't answer I can't answer the question, or you can't ask the question. So you keep asking questions. If I'm done with the question, I'll go to the other question. So blowing the nose, natriuretic is there, but two remedies which I found very, very useful. The first is causticum, and remember, second remedy is zincum metallicum. Very, very important remedy. When even just by blowing the nose, the patient has involuntary urination. Think about causticum, zincum metallicum, and of course, natriuretic is also there. So think about that. So keep asking me questions, because when I start Mater Medica, then I cannot stop. No, McFoss is not there. Or I can ask you a question. Whenever the patient becomes cold, the patient said, बहुत ठंडी है, मेरी यूरिन निकल जाती है. There is so chilly weather, the temperature is 6 degrees, 7 degrees, and I get involuntary urination. Which remedy comes to your mind? Anybody? Equisetum I'll explain, don't worry. So whenever I'm becoming cold, you get involuntary urination. Anybody? Remember the remedies which are for cold. Rustox is there, Dulcamara is there. I just told you, so that is the beauty of homeopathy, If you know the remedy, the basis of the remedy, that remedy will be applicable in most of the conditions. So no need to read the symptom wise. So on becoming cold, if you have, do think about Rustox, do think about Dulcamara, then do think about causticum. Equisetum, is a very, very interesting remedy. It is said that whenever if you do, you cough and urination, see, okay, if there are remedies, but You can simply think about causticum also. Heparis, a lot of remedies. Causticum is there, heparis sulfate is there, a lot of remedies there. Let us see something about equisetum before we close. Equisetum, it is said, it was told in when we were studying that if there is enuresis in children, if you don't understand anything, give equisetum. But equisetum urination is such an important symptom. There's a constant desire to urinate large quantity of urine. Urine is clear, it is watery, Dr. Umesh. Constant desire to pass large quantity of urine, which is watery, and it does not ameliorate. It does not ameliorate. That is more important in equisetum. And there is very sharp burning and cutting pain in the urethra while urinating. That's why we prescribe causticum and not equisetum. It is a very, very important. I just told you. Somebody asked me incontinence of urine in female. So equisetum is a very important remedy when there's paralysis of bladder in old woman. Remember the word old woman. And there is severe and dull pain in the bladder from distension, not ameliorated after urination. That is the most important symptom of equisetum, whatever I can remember from my what do you call the head, whatever symptoms that I'm sharing with you. So these three, four symptoms I remember of equisetum, which I've studied in my practice. This is the importance of equisetum. I hope you understood something about equisetum, Dr. Umesh. And thanks for asking these questions. I like to answer those questions because otherwise I'll keep speaking and the time is over. So I think it's already half an hour, more than half an hour, and we have come to the end of our one more interesting session of YouTube Live. I enjoyed it. I hope you also enjoyed it. So until next time, keep sharing your results and meet you again on next Saturday for one more YouTube Live. Thank you so much. Thank you.